I'm Matt McClain. I'm a family medicine physician with Hattiesburg Clinic, and I've been here for 20 years. I was very surprised because I was under 40 years old, so that's not very common. My surprise turned into just feeling very blessed that God was able to bless me to have this discovered at an early stage and that cancer would not end my life. I had had very minimal symptoms, but just a little bit of bleeding after a bowel movement. They did a colonoscopy, and that found a very small cancer, but it was caught in an early stage, and that was very fortunate because it saved my life. Colonoscopy is the absolute best test to screen for colon cancer. We do that for people at a certain age, just because of their age or because of family history or symptoms. There are some other stool tests that are not nearly as good, but they can be helpful if a colonoscopy is not indicated. But for most people, most of the time, colonoscopy is the absolute best test. Since I'm a physician, I was always aware of how important colonoscopy was, but it didn't hit home until it benefited me as a person. And it's been over 10 years since my first diagnosis, and I'm just so thankful to be here. Likewise, I don't want my patients to miss out on cancer screening, so I emphasize how important it is to them as well. The consequences are great. Colon cancer is very treatable if you can catch it early. Ideally, you catch it before it turns into cancer with a polyp that has a potential to turn into cancer but has not transformed yet. Generally, if you're due for a colonoscopy, if they go ahead and get the study done, they take the results of that and add that to your family and personal history, and they can determine when you need to go back. Most of the time, they can prevent people from dying from cancer if they just get their tests on time. If you're due for a colonoscopy, just go ahead and have the test done. Don't be embarrassed. Just understand that it's much better to get the test done and to benefit from the testing. If it's clear, then you have nothing to worry about. If it shows something, then we can address it. But the best thing we can do is take action. So if you're not sure if you're due, talk that over with your family physician and go ahead and take care of this so it can be handled in a timely manner.